To our first diabetes training event in collaboration with the Mount Sinai Health Teams, this being one of the many ventures that the Ministry of Health has taken a lead on to ensure that health is not only deliverable but accessible to its people of Guyana. Diabetes is no stranger to our clinics nor our hospitals. It is a global health challenge affecting millions of lives every day. Over the next 2 days, our training will focus on the introduction of a new standard of treatment guidelines for diabetes tailored to our population here in Guyana that will be used in the primary healthcare setting to better help our people to be diabetes aware, controlled, and treated. It is our belief at the Ministry of Health that through these partnerships and projects that Guyana is on a continuous innovative path to achieving a one and healthy Guyana. We at the Ministry of Health implore you to make the best of this training event and be NCD aware, committed, and wise. Thank you. I'll now invite Dr. Lachmi Lal to make a few brief remarks.
Honorable Minister of Health, Dr. Frank Anthony, Mount Sinai Health Team, consultants, Dr. David Heller and his team, trainees, special invitees, colleagues, all, a pleasant good morning to everyone. Let me just say how happy we are to finally be at this stage. After months of discussions, reviews, going back to the document, all of the input that we needed from the healthcare workers, we're finally at this point where we have a working document, a diabetes guideline that we can use for Guyana, an updated guideline. As you know, before we've had multiple guidelines in the past, and of course in the aim to continue to better our service and treatment and management of chronic diseases, oftentimes we have to review those guidelines. And so this is a timely one. The review was done, it took a couple of months. Dr. Heller would know we've been back and forth. But we're here finally to introduce these new guidelines. It's not just guidelines that are going to teach you how to prescribe medications, and it's not just because we've added new medications, but it's also to factoring all the other things that we need to do, all the pre-screening that needs to happen, and of course, the post follow-up care. As you know, diabetes is not just the management of blood sugar levels, but it's all the complications that come with diabetes. And are we really equipped to deal with those complications as they arise? And so that you'll find that the guidelines that we are presenting to you today is comprehensive. It factors in all of that. And we've actually even added something new. We're looking for pre-diabetes because, as we know, we're missing that population. There are many people with a HbA1c that are within the parameters of pre-diabetes, and we're not catching them early enough. We're getting them when they've already stepped over and have become full-blown diabetics. So this guideline is going to allow healthcare workers to bring that into the focus as well, and to wonder and to make you think that, are we missing the pre-diabetics as well? And so for the trainers that are invited here today, it's not just for you to learn the guidelines and for you to go back and to practice, but the task is given to you to go back and to teach the others in your region. Because as you know, the 60 persons that are invited here as trainers, you can't do it by yourselves. You're going to have to bring everybody on board, from the pharmacists, from the nursing assistants, all the way up to the pharmacists. Everybody has to be aware of the new guidelines. It's how you're going to work together to ensure that your patient has optimal control. And sometimes as physicians and as nurses, we might miss steps, and your pharmacists, your PCAs, all of them have to be involved in the process so that if you do skip over something, they're able to bring it to your attention as well. And so The task is a big one. It's not just to sit here for the next 2 days and to, well, we do have a very packed agenda. I know it's a lot for you to observe. The task is for you to go back and to now train the others in your regions. And it's not just going to be diabetes. This is just one of the first of the guidelines that we've reviewed. In the coming year, we're going to be looking at type 1. We're going to be looking at gestational diabetes. We're going to be looking at the different profiles of cardiovascular diseases. And so it's quite a number of guidelines that's going to come your way. And so the big task is for you to go back as champions for NCDs in your region, to push the agenda for NCDs. I know for a very long time we've been looking at primary health care and vaccination and maternal care, but we need to focus on the NCDs as well because it has crept up on us. And if anything, the pandemic has shown us the importance of addressing the NCDs. So without keeping you any further, I'd like to welcome everybody here. I hope that you will be able to observe as much as you can. Please, the consultants are here. Ask as many questions as you would like so that you have the clarity that you need so that when you go back to your regions, you're able to push this agenda. Thank you.
Now we'll have one of our consultants from the Mount Sinai team, Dr. David Heller, just to give a few remarks.
Hello, everybody. I'll be very brief. I'm really honored to be here. My name is Dr. David Heller. I am a physician and researcher and faculty member at the Arnold Institute for Global Health at Mount Sinai. I am thrilled to partner with Minister Anthony, with Dr. Lal, with Dr. Ram Singh, and all of our experts and colleagues at the Ministry of Health on this diabetes training. I want to speak very briefly about not so much the content, which my colleague Dr. Zijian Chen will get to very shortly, but the way in which we'd like to approach this. We are aware that this training is not only about what you need to know and what you need to understand, but also about your ability to train other people at all different levels of the health system. And we will help you to do that because I know that not all of you have the privilege of doing that kind of training yet. So at the end of each of the sessions, I will speak about, first of all, what are the key things that community health workers, medics, people at different levels of the health system need to know. Because we want these guidelines to be comprehensive but also simple. And we'll also have a series of fun quiz questions with prizes, as I will get to at the end. The goal being to make this as informal and interactive as possible, to make it a conversation that we have about this type of work and not just us lecturing at you. We will divide you into groups, as you can see. We will talk today, as the first of 2 days, about, first of all, the concept of diabetes and how it works and the physiology. Secondly, we'll talk about screening. And I think one thing that we're all quite proud of is the idea that we are screening everybody across the country for diabetes, preventing diabetes as well as treating it. And as Dr. Lal said, also thinking about pre-diabetes. And we'll also be talking, lastly, about medications, insulin, metformin, and many others, and we'll go through some cases related to that as well. Tomorrow we'll talk about complications, microvascular, macrovascular, and we'll also talk about nutrition and lifestyle. But the goal really is to help you to feel like you know what you need to know, not just about the guidelines, but about how to teach them. And if you have any questions, or if there's anything that you need from any of us, please just let me know. You can call me David. I want us to be as informal and casual as possible. I'm deeply grateful to Dr. Chen, Jose Alcantara, Renella Pelu, Evan Alvarez, Khadijah Jones, and the rest of our team who can be found over here. So thank you very much. I am thrilled to be a part of this team, and I'm really excited about what we'll achieve today. Thank you.
Thank you again, Dr. Heller. Now we'll have CMO to just give a few brief remarks for us.
Good morning, everyone. Right. So, for this morning, for the launching of these guidelines, the diabetic guidelines, it has been a lot of work that we have been put into this guideline in collaboration with Mount Sinai and also in collaboration with PAHO. And the review process took some time. We are now at this stage where we can launch a guidelines. We know guidelines are important to provide standard of care, and this guidelines is an evidence-based guidelines, take into consideration the changes or the new technologies that have been available, new medications, and clinical trials that have been done over the years. We know it's time for a new guidelines now. Over the years, we had several guidelines, and we realized that as times change, we need to adjust. So this is one of the stage where we will have a standardized guidelines for the management of diabetes in Guyana, taking also into consideration our local environment. So we hope that these guidelines will be implemented nationally, and we can see an impact in the short term and the long term, on the impact of diabetes, the management of diabetes care, so we can see a better quality of life for patients who are diagnosed with diabetes, and also a reduction in the morbidity and mortality associated with diabetes. The challenge will be implementing, and it will be done at all levels, especially for our primary care physicians, who are the ones who see the bulk of our diabetic patients. And we hope that they will join us, and so that we can have what we call a standardized care. A lot of times when we look into the system, we see every doctor sometimes have a different way of treating diabetes, or they use different medication and so on. And this sometimes causes issues or challenges with the system, providing the medication. Sometimes the care is not in accordance with international standards and so on. So we hope that with this implementation and the rolling out of these guidelines, we can see a standardized care of diabetes throughout the country, and we can see improvement in the long term. So I want to thank Mount Sinai, the consultants from Mount Sinai, and also the persons from WHO who assist us in putting together these guidelines today. Thank you very much.
Thank you again, Dr. Narain. And now we'll have our feature address by the Honorable Minister, Dr. Frank Anthony. Thank you.
Good morning. The Chief Medical Officer, the Ministry of Health, Dr. Heller, and the team from Mount Sinai, the doctors from the various regions. This morning, as you heard from the presenters before me, we're here for a very important exercise. Diabetes. Oh. You're hearing me better now? Okay. So, diabetes is something that we have been confronting for many, many years now. But I think more and more we recognize that if we are going to prevent or delay the onset of diabetes, then we have to do a lot of work. This is one of the diseases that are probably associated with your lifestyle. And we have seen in Guyana that people, because of their lifestyle, have put themselves at risk for this disease. And for those of you who are out in the field practicing, you probably would have seen that we're diagnosing people at an early age with diabetes. Now, part of the discussions that we were having is how do we prevent or delay persons who might be at risk for diabetes? How do we do that? What are the steps we need to take to do that? And then for those who have been diagnosed, how do we treat them and treat them effectively so that they don't develop complications? And in doing that also, we are looking at what are the standards we need to put in place. So one of the things that you would notice in these new guidelines is shifting from just using the glucometers to using the glycated hemoglobin as one of the standards. And we to ensure that we can do that, one of the things that the program has been actively working on is to make sure that we have the capacity to do this type of testing in the various regions. We also want to prevent complications of diabetes. And one of those complications, as you know, is kidney failure. And right now, we probably have about 330 persons who are on dialysis. We can reduce that number in the future by working closely to prevent the complications. Now, CMO mentioned a very important thing, and that is, we find when we look at the charts that physicians working in different parts of the country might have their own approaches of how to treat diabetes. When you're working in the public sector, we have a set of medication that we're offering in the public sector. And we have to work with those medications. If we think that there are more effective medication that can be used, then there's a process of getting those medication onto the national list so that we can buy them. So it's not a problem of getting the medication. It's a problem when you're using things that are outside of that list. And very often we see people would ignore medication that can offer the same type of help to the patient and prescribing something that is totally different. In some cases, it might sound fancy, it might sound nice, but are the patients ready for that? And so we thought long and hard about this, and that is why you would see in these guidelines what are the things that we should use as first-line treatment? What are the things that we should escalate to when we're not getting good glucose control, and so forth. And that's a very clear, well thought out approach because we want to go from one to the other to the other. And so I implore you that having gone through the training, that you would use the guidelines as we have specified them. Because when you go outside of these guidelines, then you will be putting a burden on the patients to go get the medication. That's not what we want. Now, this partnership that we have with Mount Sinai is allowing us to access a lot of experts in these fields. And as you heard from Dr. Lal, we've spent months discussing with them, working with them, putting together these guidelines. And the intention is that every year or every 2 years, we would upgrade them. But what we want is that when we train people how to use these guidelines, and that is why you were specially selected, because we ensure that we have persons from every region being here. We don't want this thing to be just in one place or another place, and then it's not across Guyana. We want whatever we're doing would be at scale, and it would be across the country. So that's a very, very important thing for us. And that is why we brought people from every single region to be here. Now, because we couldn't bring all the medical staff from the particular region, means that when you go back, you have to do a workshop similar to this and work with the doctors, the nurses, and other caregivers in your region so that you can disseminate these guidelines to them. But the work does not stop there, because making people aware that there's a new way or this is the standard that we expect is one thing. Getting them to implement it is a different thing. because we might train people and they still don't change, if they haven't been using these medications, change to these medications. So you would have to work with the program to ensure that we have implementation in every region. Now, one of the other challenges that we've had is that we don't collect stats on chronic diseases as we should. We have some statistics. I think most of it is not accurate because it's not comprehensive enough. It's not that we don't know how many diabetic patients we have, because every one of you who are treating diabetes or hypertension or cardiovascular disease, you'll put that faithfully in the chart. What we don't have is a system at the end of the month where we can tally it and send it to somebody so that we can aggregate it and we know how many patients we have in the country. So we need to have a surveillance system where we can monitor the different types of chronic diseases. As Dr. Lal said, one of the challenges that we had before, our emphasis was on infectious diseases and not so much on chronic non-communicable diseases. It is only about 2 years ago that we now have a program within the ministry that is specifically dedicated to chronic non-communicable diseases. Before that, we didn't have that built-out type of program. So this is a very young program in the ministry. But under this program, we want to look at all the chronic non-communicable diseases. We're starting with diabetes. We have, within this department, we are also looking at cancers. We want to do cardiovascular diseases. We want to do kidney diseases, and a whole host of other things. But we are not there yet. And in discussion with the colleagues from Mount Sinai, we thought that it's very important maybe to start with one. So we're starting with diabetes. And as we roll this out, by next year, we want to piggyback on the system that we built here to do maybe some of the other chronic diseases. And then over time, we'll be able to do all of them and change how we're managing people. So this is a big task. While we are doing this in terms of the program and the content of the program, we have done a mapping, and one of the things that we have decided that each of our health center should be capable of delivering certain set of services, which include managing chronic diseases at the primary health care level. And we are going to give you the tools to manage them, not just the guidelines, but we are going to ensure that the labs can be done and all the other things that you need to do better management at this level. So what you're going to be part of really is not just managing one disease, but it's a system of how we want to transform the programs that we have in the ministry so that we can have a better outcome with our patients. And more than that, I think what we are looking at is really to develop a program where we can keep people well for a longer period. And so you would see us developing over time a wellness department that can focus on keeping people healthy. The new shift now in thinking is not just about increasing a person's life expectancy, but it's also, while we increase their life expectancy, we want to also increase their health span so that they can live healthier for a longer period. And that is what we must shift our attention to and the programs that we are delivering must also keep in line with these larger goals. In each of your regions, over the next 2 years, 3 years, you would see vast improvement in terms of the infrastructure and so forth, because we are investing in developing proper regional hospitals for each of the regions. We have at least 12 new hospitals that are going to be constructed. Some have already started, and there are a number of hospitals in the interior of Guyana that would start very soon. This includes improving Lethem, building a new hospital at Maruka, building a new hospital at Cameron, building a new hospital at Keto. And with all of these facilities, you would have the requisite things to make sure that we are managing patients better. So there are a combination of things that we are doing. And we want all of you to pay attention to these changes. But more than that, we want you to be part of the change. Because without you going back to your regions, teaching and implementing this thing, then we wouldn't get anywhere. Managing chronic disease is a team effort. And that's another thing that we have to start building in the ministry. Gone are the days when you have one person who is a hero in treating the patient and that sort of thing. Maybe in the past, that is how we used to approach medicine. Now it's team effort. So for a diabetic patient, you need the doctor, you need the lab people, you need a nutrition person. And so there's a whole team that must help that patient. I don't think we are accustomed to that type of teamwork, but that is something we have to work on to change. And we're starting with these guidelines, so I'm hoping that we can start bringing that kind of change. Because diabetes is so prevalent in the country, one of the things that we did last year was to set up what we call a one-shop diabetic center. And that is, we want to cluster all the services that a diabetic would need in one place. Because the challenge has been before now that if you go to a health center, they're not able to do the testing, they would send you somewhere else. Then you spend a lot of time there, people get frustrated. If they have to get care for their feet, they probably got to go to another clinic. If they have to get a check for their eyes, they have to go somewhere else. All of this takes a lot of time, it's very inconvenient for the patient, and it leads to people not complying. And so all of this we want to change, where we can set up these centers where people can come and get comprehensive diabetic care at these centers. So this is the direction in which we are going. So I hope that in the discussions that would follow, and they're very detailed discussion, that you pay close attention, because we want each one of you to become teachers. You're going back to your regions to teach, to build teams, so that we can manage diabetes better. And we'll be monitoring that with very clear indicators. How many persons were taught in the region when you went back? So we want to see that over the next 2 months. How many persons were taught? How many of these workshops you had in the regions? Not only that, we want to start seeing what was taught, how this is now being implemented. And we are going to verify that by using the charts. We want to make sure that there aren't stockouts of medication, because we have bought a lot of medication, and if you don't use it, then it's going to remain at the MMU unused. So we want to make sure that we don't have stockouts in the various regions. And we're going to come up with various ways in how we are going to monitor patients and the work that is being done in the regions. we have to build a stronger surveillance system, especially for chronic non-communicable diseases. And the team at the ministry would be working with you to do that. Now, apart from what we are doing here in terms of diabetes, this is just one component of the program that we have with Mount Sinai. So part of what we are doing is to strengthen primary health care, and this team is part of helping us to do that and the quality of services that we are offering at the primary health care level. But we are also involved in checking our school children. And you would have seen that we have just started a program where we are screening children in school. We have started with nursery school, and those who are now coming in to nursery. And already we would have screened close to 6,000 children in that program. Our aim is by the end of the year that we would screen approximately 27,000 children. Next year, we are looking at continuing with nursery, but going over into primary, and then eventually into secondary. So during your school year, to be screened at least 3 times. So this is another program that we're working with Mount Sinai on, and we're rolling that out. And already this screening is yielding results for us. And that is because we're seeing children who need simple interventions that if we didn't do the screening, we would not have known that they need these interventions. So imagine a child who is sitting in a classroom and need glasses, but because nobody screened them and they didn't know that they had a problem with seeing, that child would continue in the classroom and have a problem not seeing on the blackboard. So we are picking up problems like this, and as we pick them up, we are fixing it. Another component of the work that Mount Sinai is doing is working directly with the Georgetown Public Hospital. And we are working there to change the style of management, the culture of the hospital, so that we can have better systems at the hospital, more efficiencies. And while we do that, we want to adopt some of those systems that we're implementing in other hospitals. So while we're starting at Georgetown Hospital, the idea is that these techniques would be used in other institutions. And there again, some of you will want you to be part of these new systems that we're putting in place. We also have some other components that we are working on, which include building out services in cardiovascular services and oncology services. And these are 2 other streams that we're working on. So the work with Mount Sinai is a very comprehensive set of measures that we are taking. And as you know, I don't need to tell you about their expertise, the type of research that they've been doing, their contribution to science, their contribution to medicine. So we are very proud to have Mount Sinai as a partner with the ministry to help us on this journey of transforming the quality of care that we can offer to the people of Guyana. So I do hope that you pay attention to what would be taught, ask a lot of questions, clarify as much as possible, because when you go back to the regions and you are doing this, you would need to answer these questions. So I wish you a productive next few days. Thank you very much.
Thank you so much, Minister, for that speech and encouraging words. I hope everyone here, all of our participants, are listening. I know among our crowds we have our MSs representing for each region. And with that being said, I'd like to thank everyone for being here this morning, for our participants for being here for the next 2 days. Honorable Minister, CMO, thank you so much for being a part of this event, sharing your speeches, your thoughts, encouraging words with the Mount Sinai Health teams. Without you, this couldn't be possible for us. Thank you so much for your collaboration. Now I'm going to ask everyone, the MSs from each region, if your MS isn't here, I'm asking for one person to represent for the region to please come forward. Honorable Minister Dr. Frank Anthony will be having a handing over session of medical equipment to the regions. This is to better equip you all in managing not just diabetes, but also hypertension. Thank you. One person from each region, please step forward. Yeah. For the persons from Region 4, Dr. Mark Forrester, I'm not sure if Dr. Barber is here.
Can you move this thing here?
Please step forward because Region 4 we
Can we
have.
move?
And also Dr. Moore, Anisha Moore.
You think we can move this?
Yeah.
Good. Keon.
Yeah, welcome.
Okay. Can the persons please step Region 1 first? Region 2? Region 3? Can I have our Region 4 representatives, Dr. Mark Forrester? Is Dr. Moore here? Anisha Moore? If I'm pronouncing that correctly, sorry. Region 6? Oh, sorry, Region 5? Very sorry. Region 6? Region 7? Region 8? Region 9? And Region 10? Thank you guys so much. Please note, each medical superintendent or representative for your regions, it's not just one device that you will be given. There are a few sites that have been selected for these Clover devices, HbA1cs, and these are the devices you will be carrying back to your regions after the end of this training. Thank you again for being here. Members of the media, thank you. Thank you. In 5 minutes, we'll be starting. We'll just have a few seating arrangements to be reshuffled. We'll start in 5 minutes. Thank you.